different things here. So here we come directly to the three parts of the spine, that is cervical, thoracic, lumbar, and here is they have added the sacrum and the, because it's a fused joint, so they have made it one over here. Cervical vertebrae, as you all know, that it is already 7, thoracic vertebrae is 12, and lumbar 5, and the sacrum actually is 1. But then, yeah, when you count it together, this can be a different one. They generally, when I was researching, it was always counted as different. Then again, there are curves, cervical curves, and thoracic curves. This is the anterior view, by the way, and lumbar curve. This has been taken from the book that Devang sir had already shared. So, coming to the spinal disorders, this is the normal condition of the spine that is already there. When you have some deformation or some disorder in this spine, that happens, there will be a disorder, or there will be a some problem with the spine, some pain or something. So here I have explained again in the theory part also what vertebrae and everything here, the tailbones, the curves. So spinal disorders, as we just discussed, yeah, it can be different for different people. I noticed there were some people who had age-related problems, degenerations. There were some injuries. Well, I was not able to take care of everybody, but then yeah, I came across some people whom I will discuss further. Abnormal postures. A very very common reason is the abnormal posture, which is happening. There can be some inflammation and infection that can affect the spines as well. So the spinal disorders broadly can be divided into the disc disorders, which will be the intervertebral disc, that wo slip disc जिसको हम बोलते हैं, that can be one. Structural disorder will be the abnormal alignment, such as scoliosis, which I just told you. Traumatic disorders will be the injury ones. Infections, yeah, there are certain infections which are there, which also affects the spine in the nerves, in the muscles areas, which segue it to the infection disorders. Inflammatory disorders, yeah, when there are inflammations and spondylitis and ankylosing spondylitis that we'll discuss later again. So we have seen that spine has supports everything. So I will discuss first with the cervical spondylitis, which is actually a degenerative condition affecting the structure of the neck. So what is a degenerative? It can through wear and tear of the body. It can be through the posture of the body, a prolonged wrong posture or poor posture of the body that can happen. So what happens in the cervical spondylitis is the formation of the bone changes. It can be age related also. Then it can be traumatic. Yeah, spondylosis has also become very common because of now excessive usage of digital things, like we are using most of the time we are on the computers, on our laptops, or maybe on our phones playing games. So that also can make the spondylitis. Cervical spondylitis and the muscular and skeletal system, I put it together because it wasn't much. That's why the cervical vertebrae, the
Uh,
intervertebral discs.
just one small correction. Please just check it out the spelling. It is spondylosis. What you're
Here,
reading is
a
spondylosis.
spondylosis. Yeah, yeah. Okay. So, musculoskeletal system. There will be cervical vertebrae, intervertebral discs are affected. The unconvertible joints between the discs, those are the ligaments surrounding the structure, can be affected. Nervous system can be involved, not in all the cases, but are involved. Cervical nerves also, and the spinal cord also. So I try to go a little bit deeper and I try to find how many cases would be there in comparing the different parts of our globe. United States, I found, was 95, no, 957.7 cases, say around 958 cases in per 100,000 population. Southeast Asia was 897. East Asia was 804. Europe was 915. So, yeah, East Asia is a little less. I wasn't able to find out the reason why it is like that. But then, yeah, I'm presuming that Southeast Asia and East Asian people would be more into exercises and moving around or something. Age risk, I see what I see now found out was 70 to 80 years. It peaks after 40, especially more commonly in women. The reason being the premenopause and the decrease of calcium and vitamin D inside the bones. So that is starting during 40s and going towards 70 and 80 years of age. Okay, so now I found a case, a live case. I came across and I was an old woman of 70 years old. One sec, I'll just take this down. 70 years, cervical spine. This is an x ray, her own x ray. Cervical, and she was diagnosed with cervical spondylitis. So, this x ray was already present with her when she came to me. So, now over here, if you notice, there is a muscle spam here, and there is an anterior astrophyte here. A bone is slightly degenerated, but then over here you can still see the gaps here, so their bones are not fused. So yeah, that I considered as a good news. This is the one which, if you want to really see how it goes here. So here there is a arc that it can be shown, and there's a small tiny osteophyte which I seen inside. So coming to what I did for her was, um, first I took her interview. I told her, not an interview or diagnosis, like just a clinical kind of a diagnosis of what I can help her with. So she had started this pain gradually because of long hours of desk job. She complained of stiff shoulders and neck, difficulty in doing chores and involving the neck movement. I would like to add here in the chores and the neck movement. When I asked her how long can you do a neck movement, or when you have to still do a desk job and put your head down, and so she said it was only max 15 minutes. So it was getting really bad, and and she said that when too tired, back gets sore and relaxes after rest. As per her vitals, her BP remains normal. She's taking medication for the same. She does regular walking, cooking, washing, and other chores. She does, but with a limited speed. She has a history. Here, there's a spelling mistake, sorry. But she has a history. Her mother already had a rheumatoid arthritis. So she was suspecting if she had something like that, but doctor said it wasn't. She takes, as per the vitamins and calcium, she's taking on daily basis, which again I would consider as a good news. Well, I haven't added here, but I did suggest her to ask her doctor if K2 was important for her. Like last time when we were discussing about the vitamins, K2 is a vitamin which helps the absorption of vitamin D. And vitamin D is used for absorption of calcium into your body. So after the observation and the talk that we had, we met for around 6 times, wherein I was able to give her therapy for 4 times. So my therapy focus, what I did was to reduce the muscular tension first of all, because she was not able to do, improve the cervical and thoracic posture. Why the thoracic posture? Thoracic posture because when I told you, like 15 minutes when she puts her head down, she would start feeling her pain, and her pain would run down to her thoracic also, and that has started getting stiff. So it was not only her cervical that was getting affected, but even her thoracic. And improve mobility between comfortable range. Why comfortable range? Because again, she was 70 years old. So I had to be very careful of what exercises to be given to her. Strength appropriate postural muscles also. Because after a certain time, like after 2 sessions or something, I noticed that she was getting better, but her muscles needed constant traction, like the traction that we sir showed us with the belt. When I tried to do that, it needed constant that one. So now I felt that if I try and improve her strength of the muscles, that would really help her. Well, she was 70 years old, so I couldn't push much. But then, yeah, it helped her a little bit. Improve body awareness and habits, because because of her sore back, even at the thoracic, the upper back has also got sore. So she told me her upper back has got sore. So yeah, there has to be something that she has to keep her neck high. She has to maintain a certain posture when she was doing some chores, maybe elevate her table for her desk job. So my therapy, including on the first day, we just had this all the discussion and everything, and a little bit of stretching here and there to understand her muscles and how she worked with. Secondly, we did with second again. I went again with the preparatory stuff. In the third and in the second, in the I started my proper, what do I say, the proper therapy during the third session, because she was not very comfortable of the sore back and her neck aching. So from the third session, we started, this is how we did it. We did the diaphragmatic breathing, and shoulder relaxation, gentle shoulder movements. Why the diaphragmatical breathing was done before? Because when people come in my part of the place where I am, if we do an invocation, it is considered to be religious hazard. So, yeah, so diaphragmatic breathing, I do my invocation only with diaphragmatic breathing, start my invocation only with that. And shoulder relaxation, of course, the gentle movements of the shoulder, gentle cervical rotation, and gentle lateral flexion of her neck, the chin retractions, scapular movements, gentle scapular movements, the retraction and the flexion, the postural work. So I had to constantly remind her how to sit. Okay, sit up straight, and your neck needs to be like this. Hold your neck eye level, etc. So this took quite at least entire session to keep reminding her all of the preparation. So we started the session with yoga postures, then Tadasan and Bhujangasan. Again, a modified version initially was done because of her age and her because she is not very continuously doing her practices. So a little bit of preparation was required. The cat and cow, the Setu Bandhasan, she was feeling better. With the strength and stability, the thoracic rotation, we did the Ardha Matsyendrasan. Pranayam, again, we came back into diaphragmatic breathing. Why I insist on the diaphragmatic breathing from the time I have been teaching yoga. if they are using that thing and they are conscious about it, they come down there, and if they are too busy in their whole worlds, they are actually bringing down their nervous system to understand that they are going to be starting the yoga, since my invocation is not allowed here. Then again, Nadi Shodhan. Uh, Nadi Shodhan was, yeah, to relax her muscles down and everything. Pranayam also, because her relaxation was better. Now, since she had a high BP, Chandra Anulom Vilom was done. So, yeah, this was the live case that I found. Segueing it to ankylosing spondylitis. Now, spondylitis is an chronic inflammatory. The other one, the spondylitis, the cervical spondylitis, was a degeneration. But ankylosing spondylitis is a chronic inflammatory rheumatic diseases. I did not, unfortunately, did not find a case in it, but then I tried to find a little bit of research what I could find on internet. So there are basically two forms: the radiographic axial, the bone of the axial arthritis, and the non-radiographic. So one particular thing can be determined in the according to the research that is shown is can be demonstrated in the X-ray, and the non-radiographic one does not necessarily be most of the time does not show in the X-ray, and it will require a further test with MRI, because it can be related to the organ inflammation also. I've then coming to the spine of how an ankylosing spondylitis looks. Now, this one on the left hand side, you will see a normal spine. On the right hand side, you will see the bone fusing. The
Can you zoom
normal,
a little bit in that picture? Zoom into that
yes,
picture.
yes, I can. Okay, it is still blur because maybe I've not saved it properly. So over here, the normal spine has got the bone. You can see all the curves here. So automatically the flexibility is there. You can see the cartilages in the between. So over here, what happens in the affected ones is the bone starts fusing. You can see the bones fusing. You cannot see the blue lines anymore. So there is an extra bone formation which creates a chronic pain and the normal curves. And the normal curves here. So there is and also the over here, which I noticed over here. Um, in this I have taken from the internet, which also shows that it can be done. This can also happen because of the immune response. It can happen of the immune response, the chronic inflammation, and very surprisingly, the gut microfibrant also. So it is like the gut is primary site wherein an overactive immune system is tested and triggered. So that can also cause this ankylosing spondylitis. Moving down, there can be also genetic factors which I came across, which is a genetic association. It's HLAB27. I couldn't remember the name, so I have just jotted it down. It was humasin lactocyte antigen 27, which is there is a problem in this gene. At that time, also this AS, let's call it AS, is also can also happen. Not always, but then yeah, generally it is happening. So when HLAB27 was showing positive, It was ankylosing spondylitis most of the time. Coming down. So over here, diagnosis requires consider overall clinical picture, also the how the test would go. So I try to find out how the test would go if it is to find out whether it is a genetical or it is something else, and accordingly we can give them the therapy. Of course, we cannot treat them, but then yeah, we can make them considerably movable. So it is genetic susceptibility. Then come the immune dysregulation. This is how the it processes towards the AS. Inflammation, tissue damage and remodeling, new bone forms, and the structure changes. Apart from genetic, contributes to 30% of the cases. Few more are considered as abnormal immune response, like I just told you, chronic inflammation in that part of the body and generates like this. Gut microbe factors were also included, and in very small cases, smoking was included as well. The most common symptoms was chronic lower back, morning stiffness. Now, like we seen the degenerated one, after rest, my patient was feeling better. But here, pain and stiffness was are still there even after rest. Reduce in the spinal flexibility, it is going to be obvious because your spine is getting fused. A constant fatigue, hip pain, and if the things are getting really bad when they are not moving properly, where there is not an alignment of the body when they are moving, in some cases there are heel pains and night back pains also. In very small cases, like they had eye inflammation. In I just found a research which was done in 2024. So this group did yoga and normal exercises, conventional exercises, basically the conventional, the normal spinal movement, the functional things, and just bending over and stuff like that. When they did was here, I have given the link. Here we go, the link. So this all the explanation of the link was given here, including the name of the what gene causes things. Here it is. And then the yoga was done for 8 weeks over here. Here are the list of all the asanas, pranayam, kriyas, and all that they did. With the general exercises, exercise group also was stretching, lateral flexion, like how I told you about the cervical, how the things were done. Here the asanas were done, and here the only with the stretches were done. So basically, they found, I've enclosed the link here. So basically, we will stick to yoga again since we are doing yoga therapy. So Tadasan, Bhujangasan, cat and cow pose, the bridge pose, the downward facing dog, the child pose, with of course how much is the problem with the person. The things will keep varying. Like my previous patient, I had when I was doing her the cobra pose, the Bhujangasan, she was not able to go up completely like how a normal spine would. So here also there will be differences. Again, I told you like pranayam, I start with the diaphragmatic breathing, anulom vilom, nadi shodhan, brahmari, and gentle chest expansion breathing I thought was would be important, because when you are you're flexing your spine behind, it actually relaxes. And in certain cases, even kumbhak could help. Naturopathy would of course be, since your spine is already very painful, so warm water therapy, warm bath, sunlight exposure moderate, because of the calcium and vitamin D aspects, adequate sleep, and anti-inflammatory lifestyle. Now, this I wasn't able to find much anti-inflammatory style diet, but then yeah, I would leave this to a nutritionist instead of me dividing suggesting this. Maintaining a health body weight, this I found was very interesting also. And stress management and relaxation, because stress management, when you are already into pain, a chronic pain for long hours, so yeah, your stress increases and your anxiety increases, so those management also is there. So in conclusion with this, yeah, so I found that cervical and ankylosing can significantly affect the spinal mobility, postures, and physical. Can be age related for cervical spine, and for chronic inflammatory, it progressive effect, because like how we seen the flow of how it is going, so it is a progressive flow. So if you are having something, if a person was having something like this, if comes early to a yoga or some therapy, would affect their mobility and will affect considerably of whatever is happening. Of course, if it is the HLA-B27 is the factor, we cannot help much. But then if it is some other factors like how we discussed earlier, that could be, can you can slow down the process there. So yeah, that's it.
Done?
Yes, sir.
Okay, great. So now it is open for question answers. Anybody wants to ask? This was a good presentation.
Just wanted to ask about that patient of yours. I mean, what's the status now uh, after the therapy you did?
As I told you, I have done 4 times therapy, and so she will still require. She's feeling a little better with the stuff that I told her, with the asanas that I told her. But then again, there is another portion that is affecting her shoulder. So she had a check. Now there has become a multiple problem. She's got a spondylosis also, and also her shoulder bone is showing frozen shoulder bone. So we'll have to take care of that again. So now it will not be only the cervical spondylosis that we'll be taking care of here. We'll also be taking care of the, and how did I come to know, if you may, or you want to know, is when you know you do the stretch like this. She was not able to go into hyperextension. So I tried to hold her hand and pulled it behind a little bit. And it was, she started having a pain, like not very much behind, just holding it and just pushing it a little behind. So she started getting that sharp pain. One shoulder, one side of the shoulder.
By the way, taking the hand up is what? What is the name of the movement?
Flexion, sir.
Flexion.
Flexion of the scapula.
Flexion of the hand, of the shoulder. This is flexion. Bringing it
Oh
down
yeah,
is
okay.
extension.
Extension,
And
yeah.
then taking it behind is hyperextension.
Oh, okay.
This is all flexion only. Okay. So another thing, you have not mentioned what not to do. Okay. So you should have mentioned what practices, and spinal disorder के अंदर there are basically 2 or 3 categories. है ना? So one is, as I had done that spinal disorder, I had done this chart, and there were like spondylolisthesis, then spondylitis, then this was the ankylosing spondylosis. This is very different. तो जो 2-3 कैटेगरी है उसको थोड़ा सा आपको एक्सप्लेन करना होगा कि what exactly are the differences in them. Okay, what points are different? Maybe sometimes the yoga therapy or the yoga practices may be similar. कि सबको आपको बेसिकली सिंपल योगिक स्ट्रेचेस देने हैं, कहाँ कहाँ पे आपको एक्सटेंशन देना है, जहाँ पे भी देर इज अ देर इज अ स्लिप दिस काइंड ऑफ यू नो सम प्रॉब्लम, तो वहां पे अपने को एक्सटेंड करना पड़ेगा। वो जो स्लिप डिस्क डिस्क वो स्लिप क्यों हुआ है? बिकॉज देयर वाज अ कॉम्प्रेशन। Okay,
Okay.
because of bending of the neck or bending from the spine. तो वहां पे वो स्लिप डिस्क हुआ था, तो उसको ट्रीट करने के बेसिकली ओपनिंग एंड बैकवर्ड बेंडिंग, दीज टू थिंग्स आर गोइंग टू हेल्प। तो ओपनिंग एंड बैकवर्ड बेंडिंग इज अ ब्रॉडर अंडरस्टैंडिंग। उसके बाद में आसन तो बहुत सारे आ सकते हैं। अगर आपको पहले समझेगा कि क्या करना है और क्या नहीं करना है, वो एक बार क्लियर समझ लेने का। आसन का नाम बाय हार्ट करने से बहुत ज्यादा फर्क नहीं पड़ने वाला है, बिकॉज वो 4 आसन करने के बाद में 5वां वापस आपको सोचना पड़ेगा। लेकिन अगर आपने कॉन्सेप्ट समझा है कि मेरे को तो स्पाइन को खोलने का है, तो फिर आप 10 प्रकार के आसन, 10 प्रकार के स्ट्रेच बहुत सारा दे सकते हो, जब आपको कॉन्सेप्ट क्लियर है। ठीक है, तो ये आपको थोड़ा याद रखना है। ओपनिंग ऑफ द स्पाइन एंड बैकवर्ड आर्चिंग ऑफ द स्पाइन, they will be helpful in the cervical spondylolisthesis also and the lumbar also. ओके, तो दोनों अलग अलग एरिया पे ज्यादा मूवमेंट है, इसके लिए वहां पे ज्यादा प्रॉब्लम होता है। थोरेसिक में कम मूवमेंट है तो कम मूवमेंट होता है, वहां पे कम प्रॉब्लम भी होते हैं। ठीक है, तो ये थोड़ा बेसिक अंडरस्टैंडिंग। एंड द लिस्थेसिस इज व्हाट? स्पॉन्डिलोलिस्थेसिस, इट इज अ शिफ्टिंग, द कंप्लीट शिफ्टिंग ऑफ द वर्टिब्रेस, जो एक दूसरे के ऊपर बरोबर स्टैक हुए रहते हैं, एक हाथ अचानक से आगे या पीछे स्लाइड हो जाता है, दैट इज कॉल्ड एज स्पॉन्डिलोलिस्थेसिस। ओके, तो ये थोड़ा सा आपको एक्सप्लेन करना थोड़ा और बेटर चाहिए था, बट so okay, I hope you have included somewhere in your list. If not, you can add this point also about the listhesis, and probably you can, good that you have added all the figures and facts and all of that. uh, Probably you can also, if possible, just put some photograph of all the asanas if possible, क्योंकि ये जो आपका, जो ये आपने इतना अच्छा बनाया है, if somebody gets it, maybe they don't know what is a bridge pose, or maybe they don't know what is a bhujangasana. So if you even put up a photo for anybody, it will be easier to understand exactly what you mean. ठीक है,
Okay.
अब ये और एक सजेशन है, आप थोड़े से फोटोग्राफ भी डाल देना अगर पॉसिबिलिटी है तो एक छोटा सा टेबल ऐसा कुछ बनाना है, या तो
हाँ सर,
जैसे
I
भी
still
आपको।
have the word format में है, I can still add and take it
हाँ,
out.
yeah, yeah, and then just add what not to do. Okay, so just add, like, very severe strong forward bends avoid, strong backward bend like chakrasana avoid, है ना, any jerky movement avoid, ऐसा सब आपको थोड़ा सा वहां पे डालना पड़ेगा। in the exercise part, what to avoid.
Okay.
Okay? Any back pain, कपालभाति avoid, any back pain, because कपालभाति से बैक को जर्क लगता है, उसको अगर आपको करवाना ही है तो विथ बैक सपोर्ट, ये सब आपको डालना चाहिए था आपके, ये अच्छा वाला जो आपका ये है ना, couple of more pages, let it add, let it become more useful for people, ऐसा।
So लेकिन सर फिर अगर अभी ये ऑलरेडी 15 पेजेस है, if I add all this 20 के ऊपर जाएगा चलेगा?
Make it 30, no, doesn't matter,
Okay.
no problem.
वो स्पॉन्डिलाइटिस एंड स्पॉन्डिलोसिस का वो मुझे ध्यान में आया कि मुझे डालना चाहिए वो, बट देन व्हेन आई रीच द मैक्सिमम 15 पेजेस तो मुझे ऐसे लगा कि बहुत ज्यादा हो रहा है ये।
Make it more, doesn't matter, because you have a lot of content, right? There are spinal disorders of different variety, and along with the ankylosing also. They are all very, very different. And उसके टेस्ट भी थोड़े थोड़े अलग हैं, तो it is good to include.
Okay. Okay, sir.
Any other question, anyone? ठीक है. So, okay. Thank you very much, everyone. Thank you, Malvika. It was a
Thank you,
good
sir.
session, good
Sir.
presentation, and I hope everybody gets some inspiration. Yes, Geeta ji.
सर मुझे पूछना था, जैसे फ्रोजन